This is part 2 of my talk about how to process a renogram. In part 1 I gave you an introduction and explained what a renogram is, and now in part 2 I'm going to talk about background subtraction. I'm going to describe a model of the renogram and use it to demonstrate how to recognize when background subtraction has been performed correctly. The model I'm going to use is a compartmental model that considers the body divided into 4 compartments. We have the blood compartment, into which we inject the tracer, the radiopharmaceutical, and an extravascular tissue compartment comprising all the tissues that are outside the blood. And the tracers that we use, the radiopharmaceuticals, can freely diffuse between blood and extravascular tissue in both directions, both from blood into tissue and back again from tissue into blood. The radiopharmaceuticals are all excreted in the kidneys either by glomerulofiltration or by tubular secretion, or a combination of the two, and that removes the tracer from the blood into the kidney, and that's a one-way process. The kidney, represented by the tubules and the pelvis, is where the radiopharmaceutical will pass through before eventually moving on into the bladder. So we're going to see how this compartmental model predicts how the concentration of tracer will change with time in each of these 4 compartments. When we inject, initially all the tracer starts off in the blood, so the concentration in the blood must start high. The tracer in concentration in all the other compartments must start at 0. So immediately after injection, the high concentration in the blood begins to fall because of 2 reasons. First of all, it's falling because it diffuses from blood into extravascular tissues, and secondly because it's being extracted from the blood into the kidneys, and that's the process that we want to see. So the tissue concentration starts at 0 and rises, the blood concentration starts high and falls, and the kidney concentration starts at 0 and rises. It will continue rising for a while because it takes a few minutes for the radiopharmaceutical to pass down through the tubules and the pelvis before it begins to excrete into the bladder. But after maybe 3 or 4 minutes, excretion into the bladder begins, and then the kidney concentration will go down and the bladder concentration will begin to go up. Now, all this time the blood concentration is going down, but the extravascular tissue concentration is going up. So sooner or later there comes a time when the concentration in the tissues is greater than the concentration in the blood. And at that point we get a net diffusion back in the opposite direction from tissues back into blood. That means that the tissue concentration will reach a maximum and begin to decline, and the blood concentration, although it continues to go down, now goes down less quickly because it's being replenished from the tissues. So the kidney concentration continues to go down and the bladder concentration continues to go up, so that eventually it all ends up in the bladder. Now the curve that we want from this is the kidney curve, representing activity in the renal tubules and pelvis. Notice that the blood curve doesn't form part of the renogram. Even blood in the kidney itself, in the renal artery and the renal vein, the activity in there has not been extracted into the kidneys. It's only activity that's been filtered or secreted from the blood into the tubules and pelvis that we're interested in for measuring kidney function. So it's the green component that we want. And the model says that the curve for the kidney is a curve that rises from 0 in a smooth curve up to the peak before it comes down again. Clearly it must start from 0. It doesn't rise in a straight line because the rate at which it rises depends how much there is in the blood. Initially there's a lot in the blood, so it's rising quickly in the kidney, but as the blood activity falls over the first few minutes, then the rate of rise in the kidney must also fall because there's less in the blood. So the kidney curve is a gentle, smooth curve that rises from 0 and begins to flatten off a bit before it reaches the peak. So the model says that that's the shape of the curve that we expect for the renogram, and the blood should be falling all the time. So when we come to draw regions of interest, we naturally draw around the kidney. That includes quite a few tissues. First of all, we've got the renal blood vessels, the renal artery and the renal vein, where there's plenty of blood within the kidney. It's a very vascular organ. We've then got the renal tubules and the renal pelvis, where the activity is being excreted and is passing through the kidney. But we've also got overlying tissues, muscles that lie in the patient's back between the gamma camera and the kidney. Now the model says that what we're interested in is the activity in the renal tubules and the pelvis. We're not interested in what's in the renal blood vessels because that's just blood background. The kidney hasn't done anything to remove activity from that, it's just passing through the kidney. Likewise, the overlying tissues in the patient's muscles in their back are tissue background that don't form part of the renogram. So to remove the background, if we draw a suitable background region of interest, somewhere that includes some blood vessels and some tissues representing blood and tissue background, if we get it right, we can subtract the background from the kidney to leave just the desired renogram. We've subtracted off both the blood and the tissue background. However, you have to realize that the optimum background region of interest must include the correct mixture of both blood and tissue background. We're trying to subtract two different sorts of background, and we've got to get the combination right. So we can see that if we take a curve from a kidney region of interest, there are three components in it. There's the tissue component, shown in purple here. There's the blood component, shown in red, and that starts high. And then there's the renal tubules and pelvis, shown in green. Now, although that starts at 0, by the time we stack up all three components together, the tissue, the blood and the renal tubules and pelvis, the composite must start above 0 because it's the blood, the component, that starts high. So this is the curve you would expect from a kidney region of interest, and if we take the curve from a background region of interest, it comprises a mixture of blood and tissue. So hopefully, if we subtract the background from the kidney curve, we should end up with just the green component, the renal tubules and the renal pelvis, and that component should start from 0. So we can say that if background subtraction is correct, the renogram curve should rise smoothly from 0, because that's what the model says. If it doesn't start from 0, then we know there's still some blood background present. So we hope for a curve like the green one on the right, which starts from 0 and rises smoothly to a peak. If we have something that looks like a curve on the left that starts above 0, we know there must still be some blood background present, because the blood is the only component that starts above 0 at time 0. So those were some hypothetical curves from my model. Here's some curves from real data with technetium labelled MAG3. I've taken a region of interest in blue round the left kidney there and got a curve like this. You can see it does rise up to a peak and then come down again, and it doesn't quite start from 0, and that's not surprising. There is plenty of blood within the kidney, and so we don't expect it to quite start at 0 because of the blood component. Now, if I take a region of interest shown in red there over a vascular organ like the spleen, where there's plenty of blood, we get a curve like this red one, which, like the model, starts high and falls with time. I'd like to find a curve that had no blood, that was entirely tissue, but unfortunately there's nowhere in the body that has no blood at all. But if I take something like this turquoise region from underneath the kidney in an area that's mostly tissue with very little blood, we get a curve that's very different. It doesn't quite start at 0, indicating there is some blood there, but it does rise for a bit and then fall again. But the key thing from this is that we get very different answers depending which background region we take, particularly during the first few minutes, which is the important time for background subtraction in the renogram. So it's important to get the right region for correct background subtraction. It makes a big difference whether we take one above the kidney or below the kidney, because they differ completely during the first few minutes. So let's see how to recognize whether we've got it right. The question is, do you think that this renogram curve is correctly subtracted? Well, clearly my model says that it should rise smoothly from 0, and this starts well above 0, so it can't be right. In fact, that offset there is the amount of blood background still present in this curve. So the answer must be that it's under subtracted. We have not taken off enough blood background for this curve. But what about this one? Is this Renogram curve correctly subtracted? Well, it does seem to start from 0, but the model said it should rise smoothly from 0, and I emphasize the smoothly, and I don't think this is a smooth curve. There is a kink at about 40 seconds in this curve, so clearly the model isn't quite right. So what we have to do is to say, well, the model is alright after 40 seconds, but before 40 seconds something seems to have gone wrong. So what I would do here is I would follow the curve, in this case starting at the peak, and follow it backwards. Follow this curve backwards. It's smooth until we get to 40 seconds, and then it kinks. So ignore the kink and just follow the smooth curve on and extrapolate to say what it would have been. So if we ignore this bit of the curve before 40 seconds, we see that the extrapolated curves gives what it would have been if it had been smooth all the way. If the model had worked all the time, the curve would have been like this. So on this criteria, I think the extrapolated curve is actually also under subtracted. There is some blood background there, but we had to extrapolate to reveal that. Well, you're saying, hang on, you've been doing a little bit of jiggery-pokery there. Why can you ignore the first 40 seconds? Well, the problem is due to mixing. During the first few seconds after injection, tracer hasn't had enough time to mix uniformly throughout all the blood. The concentration will naturally be high close to the injection site and lower further away in the blood. Now, under those circumstances, the compartmental model doesn't work immediately. It assumes that tracer was uniformly mixed in the blood, and that actually takes a few seconds to occur. So during those few seconds, the blood activity in the background region may differ from the blood activity in the kidney region, so it wouldn't be surprising if background subtraction may be wrong initially. So that's how I justify saying it's acceptable to ignore the first few seconds of the curve if it's not smooth, because we haven't yet achieved proper mixing. The question then is, how long should we ignore? Well, the length of time before mixing is complete varies between patients. Sometimes it can be very quick, in less than 20 seconds. It can be up to 40 seconds. The maximum I've ever come across is about a minute. So I think we should be prepared to ignore up to 1 minute's worth of data if mixing is not complete. And in that circumstance, we use this eyeball extrapolation that I've just showed you to fill in the gap to say what it would have been if the model had been valid all the time and it had been a smooth curve all the way. So here's another Renogram curve. Is this one correctly subtracted? Well, it's not difficult to see that it starts well below 0, so clearly we have taken off too much background. It's over subtracted. We've subtracted too much blood and it's gone negative, and that's silly. We can't have a negative curve. But what about this one? Is this Renogram curve correctly subtracted? Well, it seems to appear to start off negative, and so you might say it's over subtracted, but hang on, there's a kink. So when there's a kink, what we do is we extrapolate the smooth bit of the curve. So we start at the peak, follow backwards and extrapolate beyond that kink, and we see that we get a curve like that. So that's the smooth curve that we would have had the model been correct all the way, and that does seem to have started from 0. So I would conclude from that curve that background subtraction is correct. After extrapolation, it does rise smoothly from 0. So what we've seen there is 3 different situations. The red curve is clearly over subtracted. Actually, the computers tried to be helpful here and not display any negative numbers, which are obviously silly. So it's chopped off that negative bit, and so rather than seeing the negative bit of the curve, all we see is it's starting late. But clearly that can't be right. That's over subtracted, and everyone recognizes that as being silly. The blue curve here at first sight looks like it starts from 0, and therefore you might say it's correct, but when you realize the kink and you extrapolate, that is the one that is under subtracted because there is still blood background there. The yellow curve is the one that is correct, although it would appear to start negative when you recognize the kink and extrapolate. It does actually start from 0. So the rule is, if the curve has got a kink during the first minute, then we extrapolate to overcome this mixing phase. And the lesson is that a correctly subtracted renogram curve will rise smoothly from the origin after extrapolation during the first minute, if necessary. So it's something like the yellow curve that you're looking for. Now, if you read any textbooks, you'll hear them talk about 3 phases of the renogram. Old textbooks describe 3 phases of the renogram. Phase 1 is the vascular phase, representing blood coming into the kidney, and that rises very rapidly as the blood comes into the renal artery. Phase 2 is the uptake phase, as tracer is removed from the blood and excreted into the tubules, and phase 3 is the elimination phase, as it passes on into the bladder. Now, that implies that the curves must start above 0, like this, because that's what the vascular phase is, it's blood activity. But modern textbooks omit the vascular phase and say we have a curve like the yellow one, which has an uptake phase and an elimination phase, but no vascular phase. So that means those curves should start from 0. That's in agreement with what I've just described from the model. So why is the difference between what I've just told you, which agrees with the modern textbooks, and what the old textbooks say? Well, it goes back to what I talked about in part 1 of this talk about some of old probe renography techniques. Back in the 1970s, renograms were acquired using probes. The patient would sit in this chair with probes over the kidneys, and the count rate from the electronics would be plotted out on this chart recorder in real time. So no processing was required. You got the curve showing the activity coming into the kidney, and you see this rapid rise here, which is the first phase, the vascular phase. You see the slower rise, phase 2, as it's extracted into the tubules, and you see the third phase as it's eliminated into the bladder. But this system didn't give you any easy means of background subtraction, so whether you liked it or not, the vascular phase was always present. That was described as an essential part of the renogram. But by the 1980s, people were using the gamma camera to acquire renograms. The gamma camera was interfaced to a nuclear medicine computer, and so the computer could be used for analysing the data, and we would draw suitable regions of interest and get activity time curves. Now background subtraction was possible, and you could draw regions wherever you thought appropriate, but background was assumed to be mainly tissue, so regions underneath the kidney were quite common. But inevitably this means that the vascular phase still remains part of the renogram in the same way as it did for the probe renograms. So the curves don't start from 0, and we still have this vascular phase representing blood flow into the kidney, and that could be used to assess renal perfusion as part of the renogram. However, modern gamma camera renography uses other processing techniques which can remove blood background. So nowadays it's recognised that the vascular phase is not really part of the true renogram, so it should be removed, and therefore the renogram curves should start from 0, as we see here. If you want to analyse the renal perfusion, the modern way of doing it would be to analyse the first few seconds, the first pass data separately without any background subtraction, and do that as a separate analysis, and not take that to be part of the renogram. The renogram itself should have the vascular component subtracted. So I think that's the modern way of looking at things, and that explains the discrepancy between the modern textbooks and the old textbooks. However, there's another problem, which is slow circulation, because it takes a few seconds for the bolus of activity to get from the injection site to the kidneys. So it's quite common practice to start the renogram a few seconds after the injection, start the renogram acquiring when the activity is seen to be coming down the aorta and approaching the kidneys. However, if you start the acquisition immediately after the injection, then inevitably there will be a delay before it appears in the kidneys. That often happens if you're combining the Renogram with a first pass study, because you don't want to miss that first pass down the aorta and into the kidney, so you will tend to start the acquisition sooner. It may also happen if the patient's got slow circulation, so it takes much longer than you expected for the activity to appear down the aorta. However, it's easy to identify that by looking at the first few images of the study. Some analysis programs may adjust for this by shifting the time axis, but if that isn't done, then you have to bear in mind that the real origin of the curves, where the Renogram actually starts, may be later than time 0 on the Renogram scale because of this delay. So here's what I mean by that. Looking at this Renogram curve and thinking, is it correctly subtracted? You may say, well, yes, if I extrapolate, it certainly looks okay. But have a look at the images for this patient. Here, the first 20 seconds we see there's nothing yet appeared in the field of view at all. 20 to 40 seconds it's still in the lungs, and it's only by 40 seconds that it begins to come down into the aorta and appear in the kidneys. So actually the real Renogram doesn't expect to start until about 40 seconds in this patient. So the true origin of the Renogram is not time 0 on this scale, but 40 seconds. That's when activity would be expected to appear in the kidneys. So some computer programs might shift that and remove the first 40 seconds for us, but if not, we have to bear in mind this true origin of the Renogram. Then we see it actually looks under subtracted on that scale. If we get a curve like this, this is what we would expect for this one, because when we extrapolate, that is the one that extrapolates to the true origin, so that would be the correctly subtracted curve for this particular patient. So that's a little pitfall to just be careful of. So what we've learned from this is that background subtraction is judged to be correct when the Renogram curve rises smoothly from 0, bearing in mind that we may have to extrapolate to overcome incomplete mixing during the first minute, and we have to assume that the bolus appears in the kidneys during the first frame of the study. So that's the end of the second part of this talk. In part 3, I'll look at some real examples of background subtraction.